Assalamualaikum dan salam sejahtera semua. Selamat datang ke podcast Hasa 360. Okey, saya Dr. Nabila akan menjadi moderator pada hari ini. Dan kita hari ini akan membincangkan satu topik yang agak menarik. Saya boleh katakan sangat menarik sebenarnya. Dan juga topik yang menjadi bualan harian untuk rakyat Malaysia. So without further delay, saya ingin menjemput kita speaker kita dan juga kita punya tetamu hari ini iaitu Dr. Diva.
Hi.
Okay, how are you, Doctor?
I'm good. Thank
Okay.
you. Thanks for the invite.
Okay, thank you very much. I'm very honoured to have you today.
My pleasure. My
Alright.
pleasure.
Okay, so Doctor, since this is first time you are coming to this podcast, so I think maybe our viewers will like to get to know you better.
Okay.
So maybe a little bit about your backgrounds, achievement, and also your interest in medical and surgical world.
Okay. So, hi everyone. My name is Theevashini Krishnasamy. So, I'm currently working as a consultant upper GI, bariatric and general surgery surgeon here in Hasa and under UITM. So, I started my medical journey back in 2004. Once I graduated, I worked for a few years in the UK. Then came back home to complete my master's in surgery under University Malaya, and subsequently did my subspecialty in upper GI and bariatric surgery.
Okay, Dr. Tiva, just like I mentioned before, hari ini kita akan bincangkan satu topik yang menarik dan dekat dengan rakyat Malaysia, which is topik obesity dan juga bariatric surgery. Alright, so saya ada baca satu statement daripada newspaper back in 2024 lah, end of last year actually. Statement daripada kita punya Menteri Kesihatan, which is Dr. Zul, yang mengatakan satu daripada dua orang dewasa di Malaysia tergolong dalam kalangan obese. So this is a very serious matter. I think we need to cater this problem, and we need to cater this, kita kena ada exposure and also knowledge kan. So kita nak tanya soalan pada Dr. Tiva. What does it mean by obese and also overweight? Because I think lots of us are confused with these two. Berat badan yang berlebihan dan juga obesity. Apa perbezaannya?
So, secara umum, obesity and overweight, it relates to the amount of unhealthy body fat dalam badan kita. Ya. So lemak yang terlalu tinggi, tahap lemak yang terlalu tinggi. Ya. So in terms of category overweight dengan obesity, dia sikit berlainan dari segi BMI dia, body mass index. So bila kita tengok body mass index kita, overweight category is between 25 hingga 30. Obesity is beyond 30. BMI lebih daripada 30. So dalam obesity kategori ni kita ada obesity kategori 1, 2 dengan 3, and then last sekali super obese. Itu yang paling tertinggi lah dia punya tahap lemak dalam badan. Yes.
Oh ni yang kalau kita biasa kalau kita Google kan, dia ada skala tu, dia ada warna dia kan.
Yes.
Overweight kalau tak silap saya dia warna kuning kan?
Yes.
Lepas tu kalau obese dah start warna merah.
Yes.
So kita sebenarnya kita rakyat Malaysia ni kita kena maintain badan kita sampai warna hijau je. Betul tak, Doktor?
Betul.
Kalau warna hijau tu berapa pula dia punya BMI, Doktor?
So in between 20 to 25 is considered normal.
It's considered normal. So that's our target lah for a healthy body.
Yes.
So, macam mana seseorang tu, how can a person, main reason kenapa dia boleh jadi obese? Kenapa seorang tu tiba-tiba je? Is it tiba-tiba ataupun dia punya pemakanan ke, dia punya lifestyle ke yang boleh effect dia jadi obese? Okay.
So, yang ini berlaku dalam jangka masa panjang. Okay, it's not overnight. Okay, hari ni kurus, esok gemuk, tak ada. So it happens over time, jangka masa panjang bertahun-tahun. Okay, more than 5 years, 10 years macam
so it's
tu.
almost like lifestyle jugalah.
Yes.
Because it's like long term punya ni.
Yeah. So in terms of kenapa jadi macam tu, it's multifactorial. Yeah. Of course, lifestyle plays a big role. Yeah. Dari segi pemakanan, everyday, apa yang kita choose untuk makan. Okay. and minuman. Okay, of course minuman manis. Okay, setiap hari, like hari ni you minum air manis, esok takkan put on the weight. Tapi jangka masa
Masa
panjang, yes, bertahun-tahun jadinya, then of course the excess calorie yang kita ambil tu, it will have effect on our body weight.
Sebab body tak sempat nak, kita tak sempat nak expand lagi
the energy, yes. Selain daripada tu, our work stress.
Stress,
mental stress, emotional stress kita. So kita punya stress hormone kalau dia tinggi, dia akan simpan lemak kita. Susah untuk dibuang. Okay. Dari kalau tak cukup tidur, okay, in terms of orang yang especially yang work shift ke, ataupun stress dengan kerja, so tak cukup tidur on a jangka masa panjang juga also can affect your body weight. Some medications, ubat-ubat yang patients boleh ambil, okay, juga boleh membuatkan kita cepat lapar and also put on the body weight.
So kalau tadi doktor cakap regarding the kerja kan, that's why I notice like even though kita in healthcare punya sector kan, somehow in healthcare, people who works in healthcare actually also those yang hadapi this kind of problem lah, obviously. Not only those staff but also the officers, the medical officers especially, because they work like really long hour shift, and tak cukup makan, tak cukup tidur, and then makan pun that rushing kan. Dia macam like sekali, maybe that's the only meal, that only time you have that day to have a meal, so you just eat whatever you can. So and then
kita punya on call semua,
that's why dia boleh effect kepada kesihatan juga. Alright.
And then selain daripada tu also penyakit yang mungkin they have which can make it harder to lose weight. For example, untuk wanita, PCOS, okay, polycystic ovarian syndrome, boleh membuatkan mereka susah untuk turunkan berat badan mereka.
Is it something related to thyroid juga kan? Hypothyroid, if I'm not mistaken. Hypothyroid.
So underactive thyroid boleh membuatkan mereka cepat
gain weight. So if like you rasa badan you tiba-tiba naik berat dengan mendadak, so it's better for you to have a full body check-up. Am I right?
That's right.
So you check any possibility, like jangan biarkan dah hujung-hujung dah terlampau bertahun-tahun tu barulah you nak seek for help. Okay. So kalau dah those yang dah already in obese category kan, I'm sure macam yelah, benda ni is not normal. So kan kita boleh cakap macam sakit jugalah. Am I right?
Yes.
So how does it impact a person punya lifestyle, a person punya health?
So obesity, we are trying to get it recognized as a disease, as a penyakit, because penyakit ni bila sudah ada, dia punya risiko untuk penyakit-penyakit lain untuk datang is
hinggap sekali. Dia attract. Dia macam attract.
So high risiko lah, so what they call the 3 serangkai, So you've got the hypertension, kencing manis,
and then cholesterol.
So semua akan datang sekali, and the issue is it can make it worse by getting heart diseases as well. So sakit jantung, serangan jantung, stroke, and patient yang obese ni mereka boleh ada susah pernafasan.
Shortness of breath. Dia akan asthma sikit lah.
Not so much of asthma, it's what we call obstructive sleep apnea. Sebab ada banyak lemak di keliling leher, boleh susah untuk bernafas masa tidur. So orang yang berdengkur banyak malam-malam tu, and walaupun cukup tidur sepatutnya 8 jam, cukup jam dia tidur, tapi dia bangun rasa letih lagi, macam tak cukup tidur.
Still not enough rest.
So that is a sign that they might have obstructive sleep apnea.
So body tak relax waktu tidur. It should be like 8 hours of sleep tu kita relax kan?
Yes. So because in between masa tidur tu dia tak realise, dia boleh stop pernafasan dia.
So it's very concerning.
It is. And most of these disease, especially the obstructive sleep apnea patients, they anggap it's normal for them, so they don't seek medical attention for it. They think it's part of their lifestyle, so they just biarkan saja.
Sebab kadang-kadang kalau macam especially kan macam waktu raya ke apa kan kita balik kan semua orang macam bunyi berdengkur. It can be kadang-kadang berdengkur itu it can be due to penat sangat. I think
Could be. I mean again it's multifactorial, but one of the main issue untuk orang yang berdengkur is if you notice mereka generally badannya besar. Yes. Yeah.
Okay.
Yeah. So they may not be diagnosed yet with obstructive sleep apnea.
Okay, it's a good thing. So para pendengar mungkin boleh notice nanti kalau balik raya ke apa ke kan, raya berkumpul, family berkumpul, kita tengok sesama kita kalau dengar bunyi berdengkur ke apa, mungkin boleh advise lah ahli keluarga untuk pergi medical check up.
Selain daripada tu, of course it affects the mental stress, the stigma of
being big.
Yes, being big, diejek or dimalukan oleh kawan-kawan ke, family members ke, so they may have that stigma, that insecurity, so that's emotional stress for them. Yeah. Selain daripada tu, of course, joint pains. Okay, so I get banyak patient yang datang kat klinik saya complain yang mereka tak boleh, because of course majority of my patients are Malay patients and they have difficulty in bersujud.
Performing solat.
Yes, bending down, being on their knees, untuk bersolat ke, untuk sembahyang ke. So they have to sit on the chair untuk sembahyang.
Solat.
Yes. So that is a big issue for them, of course, joint pains, because berat dah besar, so it has extra pressure on your major joints, your hip joints, your knee joints yang you tak boleh buat.
Because like
kita kalau boleh kita nak beribadah tu mesti kita nak beribadah dengan sempurna.
Yes.
So of course kita kalau boleh kita nak cuba sedaya upaya kita, tapi bila kita that have some restriction tu rasa sedih nanti. Tak dapat nak beribadah dengan sempurna kan.
So Dr. Tiva, mungkin pendengar-pendengar kita kan mereka tertanya-tanya jugalah kan, kita dah bincang panjang-panjang ni, nak tahu juga is that overeating is the only cause of obesity ataupun ada juga yang faktor-faktor lain. Macam tadi kita ada juga sentuh-sentuh sikit, tapi mungkin ni kita nak emphasize sikit lah bagi mereka lebih clear. Like selain daripada pemakanan, apa lagi faktor yang menyebabkan obesity?
Okay. So macam tadi kita ceritakan, of course lifestyle plays a big role. Selain daripada tu, our hormonal imbalance, okay, penyakit-penyakit yang kita mungkin boleh hadapi, for example PCOS ataupun hypothyroid macam tu. Okay, genetics also plays a role. Yeah, kalau ada family history yang semua orang badan besar, yeah, so that there might be a genetic abnormality which is passed on, okay, to the down the generations. Yeah, okay. Selain daripada tu, we have apa yang kita panggil metabolic adaptation. So kita punya body ni it's built in a way untuk conserve energy as much as possible. Yeah. So especially kalau kita dapat banyak kalori tu masuk dalam, okay, badan kita akan bekerja untuk simpan. Macam simpan the energy yang berlebihan. Dia tak nak keluarkan. Yeah, unless kita bagi stress kepada badan kita dari segi exercise, things like that. Zaman dulu-dulu our forefathers tak perlu pergi gym setiap hari because mereka semua
kerja
generally manual labourers. Yeah, so setiap hari ada keluar pergi tanam sawah padi, pergi kebun, things like that, ladang, all those. So tak perlu pergi gym specifically. Yeah, and mereka semua they were fit and they were healthy, okay, and they were normal sized BMI, okay. However, these days, okay, dengan kita punya sedentary lifestyle ni,
generation sekarang ni lah.
So we have to make that extra effort, sebab semua orang pun ada 24 jam sehari, tak ada orang yang dapat lebih. So apa yang kita buat dalam 24 jam tu, it matters, on and it reflects on our well-being. Okay, so and things like macam kalau tak cukup tidur, our hormones will play havoc in our body.
Haywire sikit hormon kita kalau tak cukup tidur kan, akan jadi stress.
So dalam stress tu dia akan lagi simpan kita punya lemak, tak nak bagi dia keluar.
Satu lagi, bila kita stress, kita akan makan.
Stress eating.
And then stress eating, not only stress eating, and then like I sendirilah, kalau I stress, benda manis.
Yes.
All those sweets, chocolate, sweets, and then all those drinks yang nanti I mulalah pelik-pelik beli air yang manis-manis. Sebab I need this just to feel better.
Yes.
Dia punya punca tak cukup tidur.
Yes.
Sebab tak cukup tidur, tengok movie.
Yes.
So that's how your time management actually is very important.
Yes.
Kita macam doktor cakap ada 24 hours a day. Kita semua bekerja. And of course kita bekerja pun setiap orang kerja bidang yang lainan, berlainan. So ada yang office work, ada yang labor work, ada yang healthcare work. So but then you have to try to manage your time, and then know what you have to be careful of what you take.
Yes.
Because sometimes kita tak sempat nak pergi gym. Kita tak sempat nak no need to pergi gym lah, kita tak sempat nak brisk walk pun.
Yes.
Because of work schedule kan. So but then you have to be careful of what you eat, what you put inside your mouth.
Yes.
Because eventually what you put inside your mouth, it will reflect your health. Am I right?
That's right.
Okay.
Yeah.
Okay, Dr. Tiva, this one I got some data from the World Fact Book by Dental Intelligence Agency from 2016 to 2024. So from this, it says that in Asia, sea country, Asia Tenggara, Malaysia actually has the second highest of overweight population, which is kita punya rakyat Malaysia berat badan berlebihan up to 19.7%. So kita second highest. So the one yang paling tinggi adalah Brunei, our neighbor, with the population obese population up to 28.3%. And the third in place is our neighbor also, Thailand. So it's 11.6%. So actually this is very worrying lah, because kita semua negara jiran. So somehow benda ni agak merisaukan juga kepada kita. And then mungkin kita boleh sentuh sikit berkenaan dengan cara-cara ataupun bagaimana kita nak try ubah lifestyle kita ke arah lebih sihat. Mungkin we don't need to do the big things like paksa diri pergi sign up, pergi gym, and pergi masuk marathon ke apa. Maybe the small things matters, I think. Maybe we can touch a little bit about that.
Yeah. Okay. So there are a lot of things that we can do, to adapt to our daily lifestyle. Small steps. Things like macam bila kita datang office untuk bekerja, kita park kita punya kereta jauh sikit. So you boleh berjalan kaki pergi office.
Increase your steps.
Increase your steps. Yes. And also selain daripada tu, if don't take the lift, climb the stairs. And also bila kita duduk kat kita punya office table, kalau you have the opportunity to change the height of your table, so you boleh berdiri dengan
sambil buat kerja,
sambil buat kerja,
sambil start kan, meetings ke apa, boleh diri sekejap.
Correct. So tapi kalau you kena duduk juga, then every 5-10 minutes pergi jalan, or 15 minutes, pergi jalan the office floor. So you increase your steps lah, berjalan tu, activity tu. And also bila masa duduk, you boleh buat exercise dengan kaki banyak. Okay. And also have a dumbbell kat you punya desk tu, boleh je angkat
0.5 tu kan. So it's just like
light exercises. And you can kalau you nak jalan, you boleh carry your bag. Okay, maybe you have about 2 kg 3 kg bag. Boleh angkat, macam angkat berat badan, angkat berat. So small things which you can do. And also bila nak makanan kena jagalah, of course. So amalkan the suku-suku separuh. Kalau tak tahu apa tu suku-suku separuh, please Google. Banyak benda boleh cari kat Google.
KKM has been advertised this for I think years dah. Suku-suku separuh, kat TV pun ada iklan suku-suku separuh. So we have to take it seriously.
Correct. And then the air manis, if perlu juga air manis, keep it to once a week lah. Jangan setiap hari, every meal you nak makan tu kena ada air manis. Air kosong dah cukup untuk kita punya badan. And also bila malam tu, have an early meal, okay, sebelum tidur. At least try to have it before 6 p.m. your dinner, okay. and have it light. Okay, so kalau boleh you abaikan the carbohydrate component tu. Tak perlu carbohydrate. Ya, sebab selepas tu
You don't do much activities pun.
Yes.
After that, your night tu akan you rest kan.
Yes.
So dia akan macam more tu. Maybe tengok TV, you chit chat with your families, and
Correct.
then you baring tidur. So nothing much pun. Tak guna energy banyak. So no need much carbohydrate.
No.
So you just take something light lah. Macam
Yes.
salad, buah, and then maybe protein sikit.
Yes.
All those peas.
Yes, protein sangat penting, for our cells to work optimally, And also in the evenings, amalkan budaya sihat, so you take your family members, your kids, pergi jalan ke taman, tak payah, you don't have to join gym ke apa, just setengah jam, bagi dia cycle in the park ke, or around the kawasan perumahan, sementara you jogging ke, you fast brisk walk ke.
That's the thing, Doktor. I notice bila I pergi petang-petang pergi lari kan, kadang-kadang the parents do bring the kids to the park and so on. Tapi they let the kids play, and then the parents will sit at the side playing their phone.
Yes.
Actually, why don't the parents also join the
Yes.
kids? You ajak your kids pun lari-lari juga, jalan-jalan, and then you play, bawa bola, main bola dengan anak. Like you involve with your kids punya activities. Because
so that's bonding time, isn't it?
Yes,
With the family members.
Okay, kepada pendengar sekalian, so kita akan beralih ke segmen seterusnya. So segmen ni agak interesting lah, agak menarik sebab kita akan berbincang mengenai bariatric surgery. Yang tergeliat lidah saya nak sebut tu. Bariatric surgery, betul?
Betul.
Okay. So, ni surgery, ramai orang tanyalah macam mana nak kurus, macam mana nak itu, macam mana nak ini kan. So actually one of the options, kita ada options which is weight loss surgery, which is bariatric surgery ni lah. So maybe doktor boleh explain sedikit what is the weight loss surgery and how does it works actually.
Okay. So weight loss surgery is khas, or khusus untuk patients yang ada obesity, a lot of misconception pasal weight loss surgery ni. Mereka ingat it's aesthetic surgery, so buang lemak. Okay, so aesthetic surgery tu macam liposuction. So mereka ingat buang lemak kat sekadar kulit sahaja. But that's not the case. Weight loss surgery is kita ubah suai kita punya cara sistem penghadaman kita untuk kurangkan lemak tu dari luaran dan dalaman juga. Okay, sebab banyak lemak dia menyelaputi kita punya organ-organ
kat dalam.
Kat dalam,
sekadar kat kulit je.
Jantung, hati, semua tu. So nak kurangkan lemak tu yang menyelaputi organ-organ tu, so how we do is kita kecilkan perut. Okay, one option is kita kecilkan perut, so kita limit apa yang kita boleh makan atau minum.
So those yang dah buat surgery tu, dia ada limitation lah, every day dia boleh makan berapa banyak je.
Yes. Sekali makan atau minum tu sikit lah. Sikit.
So perut dia dah kecil-kecil.
Yes, correct. Okay, and then we have apa yang kita panggil bypass juga. Okay, so bypass tu kita ubah suai dia punya usus, so kita createkan macam highway. So penghadaman kurang berlaku, okay, and penyerapan yang extra kalori tu kurang berlaku.
So dia tak perlu, kalau ikutkan sistem penghadaman kita kan panjang.
Yes.
So kalau panjang, makin panjang, makin lama jalan dalam sistem penghadaman tu, dia makin banyak dia absorb.
Yes.
So bila kita buat highway ni dah shortcut.
Yes.
So dia tak lalu jalan yang panjang,
jalan pintasan.
Dah buang air besar lah kan. So tak adalah serap banyak sangat kalori.
Yes. So kita force kita punya body yang kita sudah ada sedia ada kilang lemak ni, okay, kilang energi yang kita ada untuk pakai energi itu for the cell punya fungsi.
Use whatever yang kita ada.
Yes.
Force our body to use whatever that we have to make it work.
Yes.
We don't need the extra one.
Yes.
Okay.
So that's how we do the bariatric surgery lah.
Tapi ni memang untuk those yang obese sahaja. So siapa-siapa yang macam not in the category, jangan cuba-cuba.
Yes.
You are not eligible to apply for this. Okay.
That's right. Yes.
Okay. So what is the one yang tadi dah sebut sikit lah yang candidate kan, yang memang orang yang obese sahajalah.
Yeah.
Selain daripada tu ada lagi ke?
So yes, definitely it's for patients who are obese, okay. Tapi the first and foremost mereka kena ada motivation, okay. They need to want to change their lifestyle, yeah. Because for this to work, kita boleh kurangkan berat badan, okay. But then they have to understand the weight stabilizes after 2 years of surgery, yeah. So selepas tu berat badan boleh naik balik ataupun dia stabil sahaja. Bergantung kepada kita punya lifestyle. So as I said, whatever kita nak cuba tolong patient, okay, first and foremost dia kena nak ubah diri sendiri.
Dia kena serious and dia kena tahu this is a commitment.
Yes.
Dia kena disiplin.
Yes.
So memang ada mindset yang okay, I'm here to commit.
Yes.
Commit with this treatment.
Yes. Yeah, and kita ada team kita yang boleh tolong untuk help the patient to stay on course. Ya, supaya dia tak ada deviate ke apa ke, tapi dia mesti mahu amalkan cara hidup yang lebih baik selepas ni.
Dia sendiri yang motivated.
Yes, so like what I explain usually kepada patient yang baru-baru yang selalu the new patients yang datang jumpa saya, what I say is kalau you dah ada satu kereta buruk yang tak boleh jalan dah, okay, you pergi kat mekanik untuk repair, ya. So then mekanik bagi you BMW punya engine, okay, engine yang baru yang boleh pecut, jalan pecut, okay, the kereta. Tapi untuk dia jalan pecut and jalan lancar untuk for the next, you know, for the next few years, bergantung kepada dia punya maintenance.
Maintenance, betul.
Yeah, so you kena ada maintenance tu. Yeah, and no one else can do it for you, unfortunately. You sahaja yang boleh buat maintenance tu untuk jaga, make sure your badan is in optimal position to carry on, you know, that weight loss.
Kalau tak nanti you akan relapse lah.
Akan relapse. Come back to the mechanic. Datang balik dengan enjin buruk, rosak, tak boleh jalan lagi.
So, takkan kita setiap kali pun kita nak perform surgery kan?
Yes,
So is it this surgery just extra question lah doktor ya? Boleh ke buat banyak kali? Curious juga. Those yang dah pernah buat, lepas tu relapse. Lepas tu Syah okay doktor betul-betul kali nak betul-betul dah macam betul-betul doktor dah ni. Boleh tak buat lagi sekali?
Boleh. I mean, you know, we have ways and means to do a revision of the surgery. Tapi of course, you know, it comes with its risks and complications and things like that. So berapa kali you nak kena potong, you know?
Come back, at least every time pun come back to zero.
Yeah,
It's very tiring and risk to the body itself.
Risk for the body as well, you know, with the risk and complications. So we have to do it all in a safe manner. Ini bukan hari ni you decide esok kita buat operation, tak. So patients have to undergo quite extensive investigations, okay, head to toe body check, sebelum kita commit the patient for surgery. And also we need to see initiative from the patient themselves that they're committed to change their lifestyle for the better.
Because like this surgery also is not cheap.
No.
Okay? It's not cheap. It involves lots of costs.
Yes.
And also patient needs to understand that every time you lie down on the table, on the operation table, it involves risk. It's full of risk. So you don't want to let your body menghadapi that kind of risiko banyak kali. So kesian kat badan kita. Okay. Alright, doctor. So in our current advanced medical world kan, so is there different types of weight loss surgery yang available dekat sekarang dekat Malaysia lah yang kita boleh cakap.
Okay, so we have the most technically, in terms of surgery, there are few types. Okay, so technically, which is the least difficult one would be, they're all difficult, okay. However, the least difficult one would be a sleeve gastrectomy, okay, where kita potong the 2/3 of the stomach keluar.
So tinggalkan 1/3 je?
1/3. Size
2/3 bawa keluar?
Yes. 2/3 bawa keluar. So 1/3 saja. So ruang untuk makanan masuk tu kecil lah.
Sikit lah daripada besar macam ni. Mungkin jadi macam ni je.
Yeah. So that's the most common type of surgery which is done in Malaysia. The next one would be a bypass lah. okay.
Highway tadi tu lah.
Yes, so jalan pintasan ya, bergantung kepada patient punya BMI, okay. Kita ada 2 jenis BMI dengan dia punya medical issues yang dia ada. We have 2 options, okay, with regards to bypass, apa yang kita panggil Roux-en-Y gastric bypass dengan mini gastric bypass. So certain patients are more suitable for Roux-en-Y, certain patients are more suitable for mini gastric bypass.
Mini gastric bypass is the one yang highway.
No,
Kedua-dua highway.
Dua-dua highway, tapi jalan pintasan dia sikit berlainan.
Oh, dia satu attach kat A, satu attach kat B macam tu.
Yes,
lebih
correct.
kurang macam tu lah.
Lebih kurang lah.
So, kita kat sini tak cover anatomy.
So we may need to put up pictures, I think, I guess, you know, to try to explain this better. Selain daripada tu, now the emerging technique would be the sleeve plus procedures, okay. So kita buat sleeve juga, and then kita buat jalan pintasan.
Maksudnya kita buang perut,
kita buang perut,
and then kita buat jalan pintas highway.
Yes.
So dia combine lah.
Yes,
combine
dia combine lah. So it depends. It really depends on the patient's punya BMI
Situation.
dengan dia punya penyakit-penyakit yang what we call metabolic syndrome. So kalau dia ada together with metabolic syndrome, then what we will do is more of a bypass procedure lah. Yeah. So these are the three main options.
So macam every patient yang datang tu, we as you will consult them which one is the best for them.
Yes.
Because everyone is different kan.
Yes.
Macam ada background yang berbeza, dia punya underlying yang berbeza semua.
So it's not one size fit all lah.
So it's like you have depends on the patient which one fits the best.
Yes.
Okay. So doktor, kos dia mahal ke?
Okay. So what we tell patients is we need to see it as an investment. Yeah. So you know, you spend how much for your fast food, how much you spend for your you know, air manis, you know, they all berkumpul, and how much you spend for your ubat, your ubat for your penyakit, you know, every month. How much do you spend on that?
And then you spend your time to go to the appointments.
Yes, your petrol, you know, things like that. So you have to, if you want this, you have to see it as a investment for your own health. Yeah, for your own self, for your family members, you know, because they are going to be impacted when they have to take care of you when you're ill. Dengan you punya penyakit-penyakit, yeah. So you don't want to menyusahkan orang lain,
orang di sekeliling, orang yang kita sayang lah.
Yeah. Okay. So but there are ways to go around it. Okay. So kalau patients are government, okay, it can be sponsored by government, tapi kena bayar dulu lah for certain things, peralatan yang
pay and claim.
Yeah, pay and claim. Kita pakai untuk surgery tu, you kena dahulukan duit and then you boleh claim back. Okay. Patients can withdraw dari dia punya EPF account,
BSP.
account 2, okay. And then kita ada what we call medical financing, okay. So setakat ni insurance tak cover, yeah. The main insurance companies tak cover for bariatric surgery. However, we have this thing called medical financing. So like there is a company, a legit company, which covers all the medical procedures which are not covered by insurance, the usual insurance companies. Yeah. So the one we liaise with is Emden Capital. So for example, aesthetic procedures, dental procedures. Yeah. So
dental procedure also not covered by insurance.
Yes. So you can use this medical financing loan to cover for your medical expenses.
So it's just it's like a loan.
Yes.
So you borrow the money and then you can pay back in by
monthly
follow
lah.
the agreement lah.
Yes, that's right. Yeah.
Okay. Alright. So there are ways. So we can work it out. So those who are out there, maybe no need to worry too much. We will try to help you. Right.
That's
Doctor.
right.
Yeah. Okay. So doctor, all these surgeries kan, kita cakap pasal surgery, ada many types of surgeries. Of course, like we said before, surgeries it come in hand with complications, with the risk and complications. So complications, they are they are divided by early stage complication and then the end stage complications. You know, many types of complications. So what do patient expect? What do they expect for the complications, and also how we want to manage that?
Okay. So as you said, every surgery has its risks and complications, okay? But it doesn't mean that, just because you have risk, it's going to happen to you 100%, okay? So when we talk about risks of possible complications, we are talking about less than 5%. Yeah, less than 5%.
It's promising.
So if it's done the right way, so as I mentioned before, it's not today you decide, tomorrow we do operation. Patients have to go extensive health check, kena buat investigation untuk check status jantung, status paru-paru, status kidney, all that. So blood test, X-ray, okay, ultrasound, semua kena buat, and depending on apa penyakit dia sudah sedia ada, kita akan involve. So it's a multidisciplinary, okay. So pakar-pakar lain yang berkenaan dengan penyakitnya juga, okay.
Sebab those yang ada existing disease lah kan, kita akan ask opinion from their existing doctors juga untuk give some inputs.
Untuk optimize dia punya conditions sebelum surgery.
Make sure dia fit and well before masuk surgery.
So and patients dia kurang berat badan 5 to 10% sebelum surgery pun, it's very good.
So it means like patient before masuk surgery tu, we dah start dengan dia punya diet, and so kita dah diet modifications of diets tu kita dah try suruh dia try diet and so on, so that bila dia masuk operation theatre tu, at least body dia maybe dah kurang sikit lah berat.
So it's as optimum as possible lah bila kita nak buat surgery ni. And so in terms of complications, possible complications which can happen is bleeding, okay, infection, injury to surrounding structures. Sebab ini semua kita buat laparoscopic. So ada banyak organ dalam badan kita, okay. So laparoscopic dengan kita punya screen, So
mungkin viewers nak tahu jugalah, laparoscopic tu maksudnya kita masukkan kamera, doktor kan. Kita tak potong belah badan lah, perut tu kita tak belah tengah-tengah and terus buat open. Kita tebuk masuk guna kamera. Kita ada macam tangan alat kita lah, kita masuk macam tu. So that's what laparoscopy.
So potongan dia kecil lah,
je. So
lebih kurang 1 to 2 cm.
So scar dia minimal lah, baru cantik sikit.
Yes, that's right. So kita buat surgery ni, so those are the immediate complications which can happen. And apart from the anesthetic, serangan jantung, darah beku kat kaki, darah beku kat paru-paru, that can happen also. Selain daripada tu, in terms of long-term complications, so patients who can lose too much weight. Okay, so
underweight pula.
I mean, it doesn't happen often, tapi ada juga yang boleh berlaku. Okay, itu most of the time is when mereka tak ikut kita punya
suggestion,
advice,
calorie intakes daily tu.
And apa jenis makanan yang dia perlu ambil. So kalau dia tak ambil makanan yang betul, okay, yang dia perlu untuk badan dia, dia ambil makanan yang kurang dia punya nutrition untuk dia punya sel-sel berfungsi dengan optimum, then you're gonna get into problems. So in terms of satu malnutrition, kurang dia punya vitamins, things like that. So these patients have to be on almost certainly long-term vitamins lah. Okay, dia kena ambil selepas surgery. Supplements, yes, okay. And if patients ada buat bypass, the usus boleh terpusing, things like that. And also boleh apa yang kita panggil dumping syndrome. So kalau makan terlalu cepat, okay, atau minum minuman manis, things like that, and then dia boleh rasa pening ke, loya ke, macam tu.
Termuntah balik juga pun boleh juga. Because like your body macam cannot really accept those much food. So memang kena ubah suai cara kita makan, cara kita minum selepas surgery. So that one is that lifelong lah, doktor.
Yes.
Until
but after that, then the body will adapt lah. So
once body dah adapt tu, dia akan stick to that macam stagnant stage lah.
Yes, that's
so
right.
memang you pun kena makan yang takat tu je. Memang tak boleh nak overeat sangat. Okay. Tapi macam those yang relapse balik tu, maksudnya tu, dia macam mana dia boleh relapse balik tu, doktor?
Okay, so for example, so dia punya body akan adapt. So kita punya jenis, kita punya badan ni, it goes on the survival mode. So bila kita dapat starvation mode, like almost starvation mode selepas buat surgery ni. So dia akan pakai kilang lemak kita. Okay, untuk
Dia
bagi
sedutlah
energy.
lemak-lemak kita ni untuk
Untuk
bagi
energy. Yes. Then selepas tu dia dah biasakan diri dia. So what we call metabolic adaptation. Kita punya hormon semua dalam badan kita, and also our metabolic rate akan slow down. Okay, akan ubah suai, slow down, so kita tak guna sebanyak energy yang kita perlu.
As before.
Yes, as before. So it will try to keep the lemak and whatever weight we have, it will try to keep it. So then you kena bagi dia stress lah tu. Ya, dengan you punya exercise and everything. Kalau you dah stable you punya weight, you kena lagi intensity you punya exercise tu kena naik sikit.
Dah kena lagi aktif.
Yes.
Kalau tak, tu yang boleh relapse tu.
Yes.
Kalau
correct.
kita lagi laid back, macam
Yes.
okay dah kurus dah, tak apalah, tak payah.
Yes. Yes.
Tak payah buat apa sangat lah.
That's right. And also like sleeve gastrectomy yang kita buang perut
2/3.
2/3 tu, that stomach, kita punya organ stomach ni dia jenis macam balon. Okay, dia boleh sebanyak mana you masukkan dia dalam makanan, okay, dia boleh membesar
Kembang.
macam balon, kembang, tapi dia tak akan pecah macam balon. Okay, so stomach walaupun ada 1/3 sahaja, okay, dia boleh kembang. Dia boleh kembang. Kalau you force,
Keep on feeding yourself.
yes, you know, go beyond yang you boleh makan tu, over time lah. Ini bukan hari ni dia kembang, esok tak. It again happens over time.
Maybe take 2 years.
Yes, 2 years, 3 years maybe. Then you will start noticing that your weight macam
keep on increasing.
Yes.
Macam dah tak ideal weight dah. Lepas tu
Yes.
nak go back to ideal weight tu macam dah agak susah.
Yes.
Sebab body pun bila dah stomach dah kembang, keep on craving food lah.
Yes.
Kan?
Yeah.
So kita pun akan tak makan banyak.
That's right. So these patients generally we follow up lifelong. Kalau boleh. It's just that ikut patient, kalau dia nak datang jumpa balik kita, ataupun you know, they get lost to follow up lah. Yeah.
But then we try to keep track lah.
We try to keep track. Yeah.
So kita dah cover tadi a few things about the bariatric surgery. Okay, I still macam tongue twister pula sebut doktor. So aside from the surgery, is there any other alternative procedure for this to cater this obesity problem, or the surgery is the only solution for obesity?
Okay. So there are many methods, okay, to reduce weight. Of course, you know, the lifestyle, you know, what we eat, the diet, and what we do on a daily basis in terms of moving around and things, exercise. That is the one of the options lah, okay, which we all do it to different degrees, okay,
Based on kemampuan dan masa yang ada.
Yes, and it's always going to be a yo-yo, right?
Betul?
Yeah, so selagi you ikut tu, okay, cantik, you punya berat badan akan turun, you feel healthy and everything, and then you're like, okay, I'm okay now, then relax sikit, then berat naik weight. So it's a yo-yo sort of
You tend to
situation.
be like, okay, let's say it to be less intense.
Yeah.
Tiba-tiba macam terlampau laid back.
Yes, correct. So kita, you know, of course that method is always there. And then we have medications which we can help, okay, secara suntikan ataupun secara ubat yang makan, okay, yang boleh tolong kita untuk kurangkan kita punya hunger pangs, okay, our appetite, okay, our hunger
Kurangkan
pangs dengan
selera.
kita punya appetite, dengan kita punya craving juga. Okay, so kalau setengah patient, you know, they like, oh tak boleh, saya nak juga manis, you know, makanan manis, minum manis tu, I cannot live without it. So boleh, kita ada ubat yang boleh tolong mengatasi problem tu.
Oh, so
Yes.
maksudnya doktor, macam kita perempuan kan biasanya PMS tu memang a week before period,
Yes.
during period tu memang kita rasa macam, oh, I want all
Kena
those
ada
sweet
manis.
things.
Yes, yeah.
I think that's the most challenge yang kita ada sekarang ni. Kalau I lah kan, memang before period tu memang I macam, oh my god, I need all those sweet. Semua cake I kalau boleh setiap hari nak makan cake lah. I nak itulah, nak inilah. But then I keep on telling myself, no.
Yeah.
So kita ada pill sebenarnya.
Yeah, so we have that to help with regards to our cravings lah, yeah.
Oh, so kalau orang yang tak obese pun boleh juga ke doktor?
Janganlah.
Janganlah. Okay.
Okay, because semua ni it bergantung it's still dependent on our lifestyle. Ya, kita kena berdisiplin tu untuk ubah cara hidup kita. Setakat PMS tu, I mean, you know, we need to have what is life without a bit of enjoyment. Ya, so tapi kena berpada-pada lah.
Maybe like
you know,
2-3 bites okay lah,
Yeah.
and then simpan.
so as long as it doesn't take over your life, yang you memang you naik geram ke, naik, you know, like macam naik gila, you know, if you tak dapat benda tu. So if that is a problem, then yes, kita ada ubat untuk tolong mengatasi problem tu.
Sikit-sikit tu try to control by yourself lah.
Yes.
Kan?
Yeah. Okay. So selain daripada tu, then of course we have the next step up. Yeah. Okay. So expected weight loss with ubat-ubat is about 5 to 10% weight
From
loss.
the current weight.
Yes, from the person's weight. Yeah. And then one step up is of course we have like what ada yang kat depan kita, balloon. Yeah. So intragastric balloon. Yeah. So dalam Malaysia ni kita ada dua jenis.
Oh, so ni lah dua-duanya.
Yes, correct. Okay, so satu, the biru one is Sparks, and the other one is Allurian. Okay. So dua jenis ni fungsi dia lebih kurang sama. Okay, of course. So balloon ni akan duduk kat kita punya perut.
Perut. Dia letak kat perut ke kat usus, doktor?
Kat perut.
Kat perut. Dalam perut.
Dalam perut.
Okay.
Ya. So selama dia berada dalam perut tu, dia akan mengisikan ruang perut kita. Okay, mengisikan ruang kita dalam perut. So kita akan rasa kurang lapar.
Sebab perut kita sentiasa macam penuh lah.
Yes.
Because ada balloon.
Yes.
Dia macam mana letak dalam perut tu, doktor?
Okay, so dua balon ni cara kaedah untuk masukkannya berlainan. Okay. Yang biru tu, Sparks tu, kita perlukan endoskopi. Ya,
Boleh pegang
ya,
tak?
boleh. Go ahead. Yeah. So
Kita pegang dia.
we need a scope, okay, endoskopi untuk masukkan balon ni. Ya.
So scope daripada mulut lah kan.
Dari mulut,
Daripada
yeah.
mulut dia masuk scope tu, and then masuk dia bukan besar macam ni. Dia kecil dulu
Yes,
kan.
dia kempis.
Dia kempis dulu, kita tak besarkan dia dulu. Lepas
Yeah.
tu baru
Kita
masuk dalam perut.
make
Baru
sure it's in there, and
the
then baru
place.
kita akan besarkan balon tu. And usually kita masuk macam 500 ml lah air ni. Ya?
air ni.
Air
Air ni
special.
air apa, doktor?
Air ni ada dye dia, balloon methylene blue. Dalam dia punya special air tu lah. So kalau balloon ni ada problem dalam badan kita nanti, then kencing akan jadi biru. So we know that something is wrong with the balloon. Yeah.
So that's the indicator lah.
Yes, indicator. Yeah. So this balloon akan berada dalam perut kita untuk 1 tahun lebih. Okay, around 1 tahun lah. And then kita perlu buat satu scope lagi untuk keluarkan balloon tu balik.
So waktu nak keluarkan tu pun kita kempiskan dia dulu lah.
Kita kempiskan dulu,
kempiskan dulu,
baru
sebab
kita keluarkan. Yes.
So usually dalam masa 1 tahun tu patient akan perut dah penuh, dah rasa penuh.
Yes.
So akan kurang makan lah kan.
Yes,
That's
that's
the
right.
logic behind it.
Yes. So one is the isi perut kandungan tu kurang. Okay, so you tak boleh makan banyak. The other thing is ada satu hormone called ghrelin. Okay, which is produced in the stomach. Okay, so ghrelin fungsi dia untuk bila kita empty, okay, like for example kita puasa, yeah. So you rasa dia macam bunyi. Okay,
perut berbunyi.
Yeah, so it's signaling your brain yang you lapar. Okay, so that is ghrelin's function. It signals your brain yang perut sudah
lapar.
Need
to be filled.
Yes, sudah kosong, perlu makanan ya untuk mengisikan dia. So that ghrelin doesn't get secreted sebab dia dah false
alarm.
False signaling.
False signaling.
Signaling yang perut sudah penuh dengan balon ni. So dia pun macam perut sudah penuh, so I tak payah signal brain untuk kata saya lapar.
So bila brain brain kita tak dapat signal tu, so brain kita tak cakap lapar. Tapi kita sendiri tak rasa lapar ke macam mana?
Kita sendiri tak rasa lapar. Yes.
Tapi kita kena makan jugalah kan. We still have to ada time lah kan kena makan. So, kalau tak makan langsung nanti jadi masalah lain.
Yeah. So we will make sure you ada
timetable.
You ada advice on what you can eat, what you can't eat, macam tu.
So kena makan ikut time dia, and then ada dia punya amount of food intake yang kita boleh kita bagi tahu ke patient lah berapa banyak dia boleh makan.
Yes, that's right.
So is it kita akan collaborate dengan dietitian juga ke macam mana?
Yes, so all my patients I refer mereka memang kepada dietitian dengan physiotherapist. Itu mesti.
Untuk this patient yang going for this procedure and also the surgery one also?
Yes.
Okay. So
So we'll get our dietitian involved, our physiotherapist to be involved as well, to teach specific exercises yang mereka boleh buat dengan guna body weight sendiri, tak payah pergi gym semua. They can do it at home within their comfortable setting, boleh buat, just asalkan you sediakan masa at least 20 minit atau setengah jam setiap hari, and you just need a floor mat and you boleh buat you punya.
That's why you have to be disciplined lah.
Yes.
So doktor, kadang-kadang patient bila dah undergo this kind of procedure kan, either surgery or this balloon, patient complain penat tak? Sebab macam dia dah kurang makan. So ada effect penat.
Maybe they do say a bit of penat, yes, tapi when time goes on, their body will get adapted. Then bila dia start biasakan diri dengan the new
current method,
yes,
baru dia akan slowly become better lah.
Yes. And then we have the other balloon. So this one, you can hold on to that, and so this is the belon telan, belon telan, where you have this capsule, yang you just masuk dalam mulut and then you telankan dia, okay.
The capsule is not is connected with the wire.
Yes.
While
so, bila
we swallow tu.
yes, bila
fluid ni, so kita sambungkan and then dia sampai kembang. So dia ada kiraan bacaan dia berapa mil ke?
So around 500 mil.
500 mil jugalah. Kita masukkan 500 mil. Lepas tu macam kita nak tahu dia dah sit well kat dalam stomach tu macam
So
mana?
untuk ni kita perlu x-ray. Sebab kita tak ada scope, so ini kita perlu x-ray sebelum dengan selepas.
Abdominal x-ray lah.
Abdominal x-ray yang kita akan buat, make sure it's in the stomach, in the correct position, and then kita boleh cabutkan, just disconnect the catheter.
Lah.
So this balloon will last for about 4 months dalam perut kita.
Oh, this one 4 months. This one like 1 year and a half.
Yes. 1 year.
1 year.
So that one will last about 4 months, and selepas tu dia boleh serap sendiri. I mean, it will shrink. It will disintegrate. Disintegrate by itself. And it will pass out through your motion lah. Yes. Yeah.
So
in terms of the weight loss, okay, we are looking at about 10 to 15% and sometimes even more. If
within
patients,
the 4 months.
Yeah, within that 4 months.
Lagi cepat doktor?
Lagi cepat. Yeah, but if you combine it with healthy lifestyle and things like that, then of course you're going to get better results. Yeah.
Even this also depends on the patient condition juga lah doktor.
Yes.
Not all patient are
Suitable.
eligible for this.
Yes.
Kan?
Yes.
So kita kena betul-betul buat check up, consultation. We see which methods yang fits you the most.
Yes.
If you are interested in any of the methods, so we by hook by crook kena check dulu.
Yes.
Get a proper consultation, get a proper check up. Only then we can decide which one suits you the best.
Yeah.
So some patients do we give them several options. Sometimes we give them, some patients can use different eligible for different methods kan. Maybe that one patient can do boleh ke dia boleh juga buat ni, and dia boleh juga buat surgery.
Boleh. So sometimes these patients, they have their own concerns with regards to surgery. So mereka nak cuba the less risky option, first, just to see macam mana body dia terima. Yes, adapt. So this would be a good option for them. So kita panggil dia macam bridging to surgery. So
Pre-surgery method.
Pre-surgery. So once when they reduce that weight, then they may get more motivated. They'll be like, okay, I dah kurang berat badan sebanyak ni. Okay, I need to lose more. So surgery would be the next step forward. Because patients who for example berat mereka lebih 100 kg. Kalau mereka nak turun setakat 10%, 15%, memang tak cukup.
Tak cukup, betul?
Tak cukup. It's too little untuk mereka turunkan to get to their ideal weight. So surgery gives you the best in terms of the amount of weight loss you get, okay, and within the shortest duration possible. So because in terms of surgery you can lose above 20 kg, 30 kg, 40 kg even. Depending again on the individual and also depending on mereka punya lifestyle semua selepas surgery tu.
Lepas tu doktor, if a person dia macam reluctant nak buat surgery, and then they want to use this method, balloon method, kalau after macam yang the white one, after 4 months dia dah disintegrate kan, lepas tu can you insert the new one?
Boleh.
Oh boleh juga.
Boleh juga. So sequential balloon.
Sequential
it's
balloon.
called sequential balloon, tapi kita akan bagi dia punya perut rehat
Kejap lah.
kejap, maybe 1 month like that. Then kita boleh letak lagi satu balloon.
So there are ways lah to that,
There are
because
ways.
not all patients are fit for surgeries kan.
Yep.
So maybe in between that we can this is one of the options
Yes.
that's available.
Yes.
Alright, so tapi sama jugalah dia punya cost pun boleh by medical license financing tu.
Yeah.
Boleh juga
Can.
using that. Okay doctor, so it's been quite some time juga we've been chit-chatting here and there.
Yes.
So maybe this is like one last question that we can I want to ask, and we can emphasize to our viewers juga lah. So this is about a person, and what can a person can expect lah changes in their lifestyle after the surgery, the lifelong changes in their lifestyle.
Okay. So of course the main thing which they will notice soon after surgery would be the amount they can consume. Yeah,
It's not as much as before.
Not as much as before. And also we teach them on what to eat first. Okay, so we always emphasize on the protein. Okay, so the way they eat also has to change. Yeah, so the amount obviously changes. Yeah, and then the way they eat, the food which is on their plate also changes. Okay, so we always say eat the protein first. Okay, protein it's things like macam ayam, ikan, yeah, meat based, yeah, or soy, tofu,
Peas.
peas, plant-based protein. Makan itu dulu, Then you have space, you ada tempat lagi nak makan, boleh tambah sayur sikit, okay. Then last kali you punya
Carbo.
So kena ubah you punya cara pemakanan juga. Minuman stick to water.
Plain water.
Plain water, air
Plain water
air kosong. Okay, jangan tambah perisa kepada air tu, air manis apa-apa, because itu kalorinya tinggi, okay, nutrition dia kurang, sangat kurang ataupun kosong, okay, and dia boleh laju aja pergi you punya usus. And cepat dihadam, cepat diserap. So you tak perlu kalori yang tinggi tapi nutrition yang sangat kurang. Yeah. So itu kena ubahlah cara pemakanan dan
kalau
minuman.
kita buat sendiri jus macam jus tembikai yang sendiri blend without added any sugar pun,
It's we don't advise it, okay, sebab bila you dah blend dia, okay, you dah ubah dia punya chemical structure dia, okay, so dia cepat lalu and cepat hadam.
So instead of buat air, just makan
buah tu,
tu
dengan
as it
serat
is.
dia, dengan serat dia, because dia ada banyak fiber.
So kunyah je food tu sendiri.
So lebih baik you just makan buah as opposed to buat smoothie and then dia cepat lalu you punya usus and cepat hadam, cepat serap. Okay, sebab fruits pun ada banyak sugar dia. Walaupun it's natural sugar, it's still sugar.
Sugar juga.
It's still
Which
sugar.
like untuk those yang dah undergo this procedure, it's critical lah the amount of sugar intake they can have. Like even from the natural base pun is dah critical, apatah lagi yang added from the outside, artificial sugar. Right. So doktor, macam kadang-kadang patient yang datang ni yang buat prosedur ni, some of them are professionals. So bila professionals ni, as we know, most of the professionals lah, dia memang cafe independent. Tu macam mana kalau kena minum plain water je doktor?
So yes, I understand. Memang susah lah, especially doctors. We need our coffee, Tapi try to make it as least unhealthy as possible. So jangan tambah gula, okay? Especially those 3-in-1 sachets. Sudah ada gula dalam tu. So kalau boleh, either take it black coffee. Or yang sekurang-kurangnya you boleh tambah the milk, tapi tanpa gula.
Pergula lah.
Because the milk also dah ada gula dalam tu, yeah. So you want the caffeine kick kan? Yeah. So you want the caffeine kick, so you tak perlu gula semua tambah dalam tu. Yeah. So avoid the 3-in-1 sachets.
3-in-1s, and then
if possible take it black. If not, then just add the milk. Yeah.
So bolehlah helps juga
Yeah.
kan.
And then of course limit it to once a day. If possible. Yeah. Don't have it too many times.
3 times a day, which before this, maybe previously before the surgery 3 times a day, so after that kena taper down to try to be once a day. Maybe before you even go to the procedure, you dah change your diet punya habit. Try to, tak adalah lepas surgery tiba-tiba kena tukar lagi lah.
Yeah.
Jadi stress pula nanti.
Yes.
Kan?
Yes. Yeah.
Okay, thank you very much, Doctor.
Thank you.
Thank you very much for all the inputs. I'll sure the information today yang dapat ni, I rasa macam agak menyeluruh. So cater all the questions yang kita tertanya-tanya selama ni kan, about regarding obesity and also regarding the procedures can be done. So very good exposure actually. So I hope bermanfaat lah untuk kita semua, untuk semua rakyat Malaysia. Apa-apa pun jaga kesihatan, kerana kita
Health is wealth.
Yeah, health is wealth. So this is the most harta yang kita ada adalah diri kita sendiri. Paling berharga. So jaga diri elok-elok. Okay.
Yep. Thank you very much.
Thank you very much. That's all from us.
Okay. Bye.
Bye.